Temitope Odulaye. I'm the founder of House 407 Fashion, a women workwear production company. COVID-19 as a global tidal wave of human sorrow. Based on my own experience, between 1 to 10, I'm going to rate it 8 because it was life-threatening. But on the other side, there are people who are asymptomatic. And these are people who, they are carriers of this virus, but they don't tend to show it. They don't have any symptoms, they don't fall sick. And these people can easily affect others with the virus. Now, my personal experience, process, and visible symptoms that led to me being tested for COVID-19. It all started like a malaria symptoms. I have the normal headache, high fever, body pain. So after being treated for 2 weeks, I didn't get better. So one day in the middle of the night, early in the morning, like 2 a.m., I was rushed to the clinic by my husband and the vigilante guard in my area. And by then I was unconscious at that time. So I was given IVF fluid, and I was based on a whole lot of drugs and all of that. So by the next morning I was tested for COVID-19. So, and it came out after 24 hours, it came out positive. So now, the motherhood and the COVID-19, my husband was actually the one that was taking care of everything. I couldn't do anything because I was not even, I don't have the strength and the power to do anything, but he was the one that took care of the children and everything and their school and all of that. The testing process with the NCDC, that is the Nigerian Center for Disease Control, is highly commendable and of high standard. From the kits, to the agents and everything, it was well done in such a way that you could know that there was expertise in it. I didn't even get to see the person that came to take the sample. And after the sample was taken, the process of taking the sample actually is a bit rigorous because they have to swap your nose rings, the two nose rings, to your membrane to be able to get the fluid that they want. Then they have to swap the esophagus as well. And these are being kept in a bottle, a cylinder-like bottle, so for safekeeping, and taken to the lab for the test to be done. And these were well done, well articulated, done at that period. Now, the people's notion, talking about my opinion about people's notion and conviction about COVID-19, it's quite obvious that a lot of people think that COVID-19 is actually a scam. People don't believe that it's actually real. Or, on the other hand, other people actually believe that COVID-19 is just, can't happen to them. It can't happen to me. Yeah, it can't happen to me and all of that. So that is my opinion about people's notion and their conviction. Talking about the numbers are very real. And COVID-19 itself is real as well. So, but NCDC and the government, they need to have people that have been tested and recovered from COVID-19. They need them to come around and to talk about this thing. Let people get to know what they've been through. Let people really know that, oh, that neighbor, that person you are standing beside you has actually had COVID-19 and actually recovered from COVID-19. This will really help and go a long way. Now, the feeling that you have is the feeling you get when you just escape death. That is how I can say it. The feeling of being recovered from COVID-19 is just the feeling of you being, when you escape death. Exactly. So, now, talking about the mental states. For me, at the time of the medication, isolation, the whole part of me shut down. And by the time I got recovered, by the time I've done my tests, my 3 retests, and I knew that I was okay, I still had, my body has not adjusted to the fact that I had COVID-19. It took me 2 weeks for me to start taking steps, two steps, three steps, for me to learn how to walk normally. I'll walk 3 steps from my room to the parlor, then outside. Then after a period of time, then I get to walk normally again. And this fear, I had this fear of, what will people say? What will people think? How will people accept me? Will people not run away from me when they get to hear that I had COVID and all of that? So I had that, but I was able to recover from it because my family was there to support me as well. Now, the advice to people that has not been affected or that has not experienced COVID-19 is be safe. Keep all the safety measures in place. Put on your nose masks, social distancing. Please, for this period, be safe. Now, talking about the effects of COVID-19 on my business specifically, my means of livelihood was shut down for the period of 5 months. I have not recovered from it. I'm still struggling to find my foot with the business, and God is helping me. But on the other side, when you look at it, it has actually helped me to be conscious of the fact that there is something called COVID-19 and it's life-threatening and it can happen to anyone. Now, if you want to talk about the second wave of COVID-19, which is around the corner, because we are hearing it from other states and other countries and all of that, it is so important that we start talking about COVID-19 again. Let's bring in the awareness. Let's put the right people to talk about their experience, how they've recovered, and we need to enforce the safety measures so that it will help everybody. It will help us a whole lot. Nose masks, social distancing, and all of this is really help us even as we prepare for this second wave. We don't pray to have it again in Nigeria, but when it comes, let it not hit us unaware. Let us be aware and all be prepared.